Hey there, down the corner here. It's Dr. Chris Bunn from the Atlas Clinic in South Ogden, coming to you this morning with a case study. Talk to you a little bit about one of our patients that we saw. I want to share some of these images, these 3D images I think you guys will appreciate and think are pretty cool. But history, 42-year-old male, history of severe neck injury, football and wrestling, I believe. Injury to this area right here in the spine. You can see the upper cervical spine, the two joints right underneath your skull. This is your skull. These are the two joints right here. I'm going to show you some pretty cool pictures of what happens when these bones become misaligned or injured. So let's jump right into it, shall we? So if we take a look right here, this white line right here represents the center of the skull. I've drawn it straight down between the two incisors, straight down the hard palate. So that's basically the center of your skull. So what we're looking at here is that second cervical vertebrae in your neck. And what you see here is that our plumb line, the center of the skull, has shifted over to the right here. And so we're only measuring 8.9 millimeters on this right side. And that's where your spinal cord, your brainstem actually sits as it comes out from underneath the brain. So shifting that skull, taking the skull and shifting it laterally on the neck creates compression in the brainstem area, which can interrupt the vagus nerve. It can interrupt blood flow to the brain. It can interrupt cerebral spinal fluid circulation between the brain and the body and can create a number of symptoms. In his case, he was suffering from an arm that was basically dead for about 6 months. This was before he came to start seeing us, but now looking at that makes a lot of sense. And that arm still has some weakness in it, and is just not performing the way it should be. Also, headaches behind the eyes, a hunched over posture, and just tons and tons of back and neck pain. So we adjusted him, and I want to show you the difference of what happened here when we actually adjusted him. So again, here's the first one. You can see our plumb line, the compression on the right side. Now, if we pull up the second one, we drop that plumb line down again. And you can see this time it's centered right in the middle of the spinal canal, right in the middle of the neural canal. And it's gone from 8.9 millimeters up to 11.7. So almost 3 millimeters of change in there. So you're saying 3 millimeters might not be a whole bunch of difference, but when you think about the size of the spinal cord itself and how it gets compressed against those bony structures, it can make a huge difference in health and wellness and vitality. Glad to say he's doing a lot better. Hope you enjoyed this little radiology trip, radiology lesson, I should say. If you're experiencing these kinds of symptoms, if you've had head injuries in the past, if you're just not feeling your best, this technology is non-invasive. It's really quick, really easy to get done. And we offer free consultations, free exams here at the Atlas Clinic in South Ogden. If you want to get in touch with us, go ahead and hit the link, atlasclinicutah.com. Give us a call. Thanks again. Thanks for watching. We'll see you soon.